On this episode's intro segment with Grandma Bellitti, I asked my grandma how older generations viewed sex. Very different then than it is now. It's very taboo, right?
Yes.
What's the difference between then and now, or how do you feel about how people talk about sex now?
No, they're more relaxed about the whole thing, and it's not a big trauma. You know, they were different. We couldn't even talk to boys on the street or in the young men. Oh, it was taboo. My father would say, I don't want to be disgraced in the street. I want to be able to talk, look at people in the face. I don't want to be disgraced. It was like a disgrace if you had a baby without a marriage, or something like that. It was a big thing in those days. But nowadays, it doesn't matter anymore.
Yeah.
But it's still, it's nice to do it the right way.
Yeah, I mean, I think it's good to be more open talking about it, though, just from a health perspective, right? Like when it's behind closed doors and hush-hush and there's an issue, then you don't know who to talk to about it or feel comfortable talking about it, too,
Yeah, right. No, it's much better. I mean, it is better because you know what to expect, It's not a good idea to have just to wait and find out gradually,
I hate this guy.
No, I mean, it's like you wonder until you're an adult to find out what's going on.
Welcome back to another episode of Behind the Counter. Today, Sheldon, one of our pharmacists here at HP Pharmacy, are talking about libido, and this is not a Kurt Cobain or Nirvana song or anything like
that. Not that
type. Smells like tea. My libido. No, okay. Sorry, no Nirvana fans here, but libido as it relates to our sexual health, obviously, which is a huge topic this season, and it's very much related to our hormones and our hormonal level and all of that kind of stuff too. Yep. So we're going to talk about a couple different things. One, I guess, how are we defining libido again? So we're defining libido as the
I would say the emotional and mental aspect of sexual health.
Sure.
As opposed to performance and the physical side of it.
The physical side of it, right. That makes sense. Okay. And there's a lot of different factors that can affect this, right? So
for sure.
We can talk about a bunch of them. Obviously, we'll get into medication as well, specifically.
Yeah, that's also a big topic.
So from a mental perspective, your mental health actually has a huge impact on your, I guess, willingness to be physical or willingness to perform. And some people think, we I guess, I don't know the right way to say it. We just kind of dismiss it as, not in the mood, right? And then some that might offend someone else, or if you're with your partner, that kind of stuff or whatever. But truthfully, it's an thing, right?
It is, and there's so many different factors that accompany that.
Sure.
So, it's not just going to be one single aspect of your life that's determining your ups and downs.
Sure, exactly. And we'll get into that as well when it comes to medication, because medication can obviously affect the chemicals in your brain and things like that too. Mm-hmm. So let's get started by talking about, let's get beyond the genetics and that kind of stuff too, and your environment has a factor in it as well, even though I'd argue your environment probably impacts the other factors, so maybe a more indirect relationship there if your environment's impacting your mental health, which is then impacting...
It's a whole cascade.
It's a cascading effect for sure. And from a physical perspective as well, we know for sure that diet and exercise also have a big impact on this. So the reason I'm talking about this kind of stuff at a high level, I guess, is because it's not just one factor, it's not just one thing, and it's very difficult to point your finger at that and say, that is my problem specifically right there, because there's so much at play. Let's say you're going through a difficult time in your job, right? Mm-hmm. And you're feeling depressed because of that. That can in turn lead to low libido through some chemical reactions. I mean, hormones are all signals, right? Basically telling your body to produce more of this and less of that.
Exactly.
Right? So if those signals are kind of off and off balance, whether it's for mental reasons or physical reasons, you're not going to be present, I guess, let's say.
Yeah.
Right?
Makes perfect sense.
And from a nutrition perspective as well, it can actually, excessive weight can control your libido and bring it lower, but also restricted weight. So cholesterol is actually the precursor for all your hormones, which is kind of a fun factor. At least to me it's fun, but that's because I'm a nerd. But from that perspective, if you have an excessive amount of cholesterol, which, overweight, that can have an impact on it, or too little on the flip side too. So if you've been chronic dieting or doing a lot of fad dieting. Any extremes, exactly. And on the exercise front too, I also wanted to mention that the type of exercise you're doing, male and women, is different. But high intensity resistance training for men specifically can help produce more testosterone. So if you're going to the gym and, it's great to get to the gym and obviously you don't want to get hurt, but, doing some of that as opposed to just the low intensity cardio only, that may be why you're feeling the way you're feeling, right? So, and for women, a little bit more on the moderate side for sure too.
Gotcha.
So before we get into the medication, how would you, I guess, identify when someone's libido is low? What are those kind of complaints that you might hear?
It's actually very, very difficult to really pinpoint that.
Sure.
In fact, that's why this is decreased sexual function and decreased mood and things of that nature is one of the most underreported statistics in terms of medication side effects, because it's so subjective and it varies so drastically from one person to another. Definitely, I guess one way to describe it would be out of your norm. So maybe if you are typically very active and very in the mood, and then something in your life occurs, or you started a new medication, or something like that occurs, and then you become a little bit less inclined to participate, then for you, that is out of the normal, and that may be affecting you.
That's a good way to put it.
And other people, just various changes in your specific average is basically the only way to really identify that.
Gotcha. No, that makes sense. I mean, everyone's different, right?
Yep.
So, and everyone has, like the mental aspect we talked about a few times now, that might impact someone more severely than someone else, or the same mental challenge may impact one person more than another, simply because we all react differently to different things, right?
Of course.
And it's crazy how it works like that. Like, you react to something like that. We talked about the job scenario earlier, right? Well, then, maybe that leads into a fight at home because you're stressed out, and then that leads to you overeating because you're stressed, and then there's the weight gain, and then there's more stress associated with that. And it's just a complete vicious cycle like that, all of which can bring down your libido, and then that in itself stresses you out and causes some friction, right?
Any extremes, any disruption in your body, your mind, your relationships.
Right,
definitely.
For sure. So I guess, and we're going to get into the medication specifically now, because there are some medications that maybe you don't even realize, or, like, it's one of those things, like as a patient, you hear about 50 side effects, but the way side effects are presented sometimes, especially in commercials, we have side effects in this medication may include this.
Yeah, they read it at a million miles an hour.
Right.
Yeah.
And then it's just kind of like white noise. So you're like, okay. Like everything's got a side, so it's easy to just overlook it or brush past it, or just,
and especially this particular side effect is not something that is mentioned a lot. You know what I mean? It's very taboo in, certain settings and things like that.
Exactly.
So.
And I think one of our big goals this season is to empower our patients and empower you all watching to be a part or an activist in your own health, I guess, right? So if you are taking some of these medications, if you do feel, outside of your norm, like Sheldon mentioned, and that kind of stuff, then talk to someone, whether it's a therapist or, your doctor, even a pharmacist too, if they maybe say, hey, maybe this medication might be part of it, let's work with your physician, that kind of stuff too, but without that communication, and this is kind of a taboo topic sometimes, or embarrassing topic to talk about. People don't like to admit this kind of stuff or talk about, but truly without that conversation.
It's so much more common than you think.
Right, it's extremely common, and without that conversation, you can't take action and maybe try to flip it around. Like, obviously, as we grow older, things change, right? And that's a natural part of life, but maybe there's something you can do about that to change it for now and delay it a little bit or something.
Yep.
So let's get into the medication specifically. Ready, go.
I like the wording that Vince used earlier when you said vicious cycle.
Yeah.
Because ironically, the medication that is most commonly affecting libido and sexual desires and things like that is actually antidepressants, which as a class of its own is one of the most prescribed medications in the entire country. So it affects a lot of people, and it is ironic. It's sort of a paradox that you take an antidepressant to increase your mood and lift you up, but at the same time that can also lead to decreased libido and decreased physical performance and things of that nature. So this is, I feel like when we discuss things like sexual dysfunction and libido and all that kind of stuff, a lot of minds automatically think of men, but it's just as common for women to be affected, especially when anybody is taking antidepressants, because it's messing with the chemicals in your brain to try to regulate things. But like we said, anything that's out of the norm or as things in your life are shifting, that's when these changes can occur.
Sure.
So some of the common medications that may cause this fall in a class that's called SSRI, basically medications that are affecting serotonin, which is one of the main chemicals in your brain for mood and things like that.
Okay.
So those may be Paxil and Zoloft, and Paxil and Zoloft are probably the most common in that class. And then there's also SNRIs. Those also affect norepinephrine, another chemical in your brain. And then that would be something like Effexor or duloxetine.
Gotcha.
Something like that. So in terms of those classes, that's probably the most common. But then switching gears to another super common class, blood pressure. And this is a little bit more towards male patients because obviously blood pressure is what helps your physical performance as well.
Right.
So particularly beta blockers. That's any medication that ends with the letters LOL. So metoprolol or carvedilol.
I end with the letters LOL very frequently.
Vince always does. So of course, when you're affecting your blood pressure, that can have some negative effects on you.
Sure.
Something that you might be familiar with, I'll check on your little spot up there, are medications that can, or medications that are used for hair loss, which also happen to fall in the same family as prostate health. Sometimes they do a little bit of both. So obviously affecting prostate health can, affect you down there. So that's another class. So those are some of the main overall medications that can affect your libido and your sexual function.
Sure.
And then not to leave out women, some studies actually show that antihistamines, so these are the medications that you use for allergies, Benadryl, Allegra, Zyrtec, things of that nature, they are used to help to decrease secretions in your sinuses so you don't feel as congested. But sometimes it can actually decrease other secretions as well. So just keep that in mind. It doesn't happen to everybody, but it's definitely a possibility.
Yeah, for sure. And I think the stigma, a lot I'm sure it's the same for women too. I obviously can't speak from that perspective myself, but for men, there's that, that machismo or you know what I mean, like that. It's and I think the word dysfunction in and of itself, when you say that or hear that, it's like no, I'm not dysfunctional. You know what I mean?
Okay,
and
yeah, we could.
You get this like defensive immediately when you hear that kind of stuff, right?
Sure.
And when from some like you mentioned, I've taken finasteride for a while for hair loss, and that's a common side effect of it, right?
Yeah.
But the challenging thing is because one of our old pharmacists was asking me, we're a compounding pharmacy too, so we make medication from scratch. We were trying to compound that medication in a different way to possibly remove that side effect, because it would be taken topically instead of orally, right? Cool. So he was asking me all these questions. He's like, oh, so have you had experience with that? I'm like, hey, who's asking? What do you want to know, But he's like, so do you have issues with that, or do you have issues with mood and depression at that time, right? And he's asking me these things, and I'm just like, I don't know. I'm like,
I told you it's hard to identify.
It is. And I don't, naturally when you hear that kind of thing, right, you're like, well, I don't really want to admit that necessarily. It's kind of like a weird thing to admit. But on the flip side, it's like, all right, well, have I been stressed or moody? It's like, I don't know. There's always a lot going on. So maybe. But then, like what you were just saying too, if that was the first cause of this, then what's the side effect I'm experiencing from this medication? Is it the libido thing, or is it the mood thing causing that thing. You know what I mean? It's so complicated when you break it down into
and
that
that's
sense,
exactly why
you know?
I said if it's something that's a change in your life,
Right.
is what you'll have to be able to identify, not really considering, or I guess while considering other factors, if there's one particular change in your life, like you just started this medication,
Right.
then you'd be able to identify just
For
that.
sure. I guess, what do you think is a good takeaway here, or a good thing to move forward with? I mean, I think for me, have those conversations, I think would be my takeaway.
Yeah, I think that's, or don't be don't be hesitant to ignore that that's a possibility.
Sure. Okay, that's a good way of looking at it too.
Yeah.
And whether it's with your partner or a friend or a therapist or your doctor, pharmacist, if it's related into that field like we were talking about too, don't be afraid to evaluate all of that kind of stuff and really think, like Sheldon said, is this out of my normal for these kinds of things, right? Because there could be something that's impacting that. Maybe it's diet, maybe it's exercise, maybe it's your mental health, maybe it's something going on in your environment that's impacting any one of those things. And if you find the root cause of what it is, okay, now we can create a plan and take action from there, And maybe it is the medication. Maybe it's, hey, if you're taking that, hair loss thing, but it's impacting this, well, there's a trade-off there and you kind of got to make a choice, right?
Yeah, there are definitely alternatives out there. There are lots of different classes of antidepressants and a million different blood pressure medications. So there's definitely ways to substitute and try to find an alternative.
Right, but you can't find an alternative unless you're comfortable having that discussion
Exactly.
to begin with. Yeah. So I guess I know it's a sensitive topic, and I know it's something that people don't like talking about. For me, that's why it's been great growing up with a pharmacist for a father, because I just naturally, hey, Dad, here's the deal, man. Can we talk about it? So it's been a little easier for me in that sense. But it takes a little bit of, sometimes acceptance. Yeah, sure. Acceptance is the right word, or being willing to put your ego aside for a minute and that kind of stuff and say, all right, how can I address these things? What can I do about this? What will help me? Let's have a conversation about it.
Yeah, I think definitely society and everything is changing, and the media too. So it's a lot more of an open topic for discussion.
Cool. I agree. Thank you guys for all joining us on this episode. Hope you guys found it informative. If you have any questions, as always, you can find us at hbpharmacy.com or gasparsbest.com. Thank you, Sheldon, for speaking with us today. And we'll see you next time.
Thank you.
You talk to your healthcare professionals, and the major takeaway point is it does have a lot of different drug interactions.
Right.
Potentially fatal. So, don't hide that.
Yeah.
And don't get it from next door neighbor. The price has gone down a lot.